Now, when it comes to polarising topics dividing the medical fraternity right now, I don't think anything could be more controversial than Labor's 60-day dispensing reforms. Now, the PM, his local Sydney pharmacist and ALP member, Adele Tahan, has warned that the government's 60-day dispensing policy will hit pharmacies and patients, quote, like a wrecking ball. New industry modelling warns of mass closures, 20,000 jobs, some say, would be lost, 665 pharmacies could be forced to close. Today, we've had National Leader David Littleproud saying the lives of regional Australians will be put at risk from Labor's plan because pharmacies in those regions will close. He was on the ABC's Insiders program today.
And now if we lose this, we lose our last line of primary care. There will be perverse health outcomes, and I fear regional and rural Australians' lives will be put at risk. If you change that business model by going from 30 to 60 days, then that has a fundamental change on those small businesses, and particularly for those young ones that have just got into this. They now have a lot of debt with their houses and employees that they have to pay for, and those at retirement have just seen their asset, their superannuation, which is their business, dwindle away without proper consultation.
Adele Tahan joins us in the studio. Thanks for coming in on a Sunday night.
Thank you for having me.
I've been watching this and listening about it closely ever since Labor came up with this policy. On the surface, it seems a good thing that people won't have to go to the pharmacy as much. They'll be able to get the 60-day script. Why is it not going to work? Why is it going to have such a catastrophic impact?
Well, Steve, it's basically going to halve our income. And if I come to you now and I say, next month, you're going to be getting paid half whatever your salary is,
yep,
how would you feel? How would you respond?
I wouldn't be happy.
Well, would you be able to continue on paying your bills?
No. So why is that going to happen? Because people won't be coming to the pharmacy to purchase things.
The majority of pharmacies, like mine, the smaller pharmacies, derive our income from the dispensary, from dispensing prescriptions to patients. If I'm getting 50% less traffic flow and patient coming in to get their prescription filled, I won't be getting the same income. I won't be able to draw wages to pay my bills.
So how did we get to this point? I mean, as we've said, you are the local pharmacist in the Prime Minister's electorate. I mean, you've had his ear, you've spoken to him about these things. How did this come about?
Well, the government's looking for savings and they want to look good politically. I understand that, but they need to pause and consult with the sector. They can't just run a policy without talking to the providers. They have talked to the doctors, but they have not talked to the pharmacists.
The Pharmacy Guild is known as being very strong lobbyists in Canberra. How's this one slipped by those people who are down there lobbying on your behalf?
Well, it hasn't slipped by them. They have been trying very, very hard to have a productive discussion and consultation with the government so we can work with government, so the Pharmacy Guild can work with government on finding solutions so we can continue on delivering affordable medicine. So
what would your message be to one of your older customers at your pharmacy who thinks, well, this is not a bad idea. It means that I can get my script. It's going to last me 60 days. I don't have to keep going back in there. What would you say to them?
Well, Steve, the reality is any patient who gets a lot of medicines, they hit the safety net. And the safety net is exactly that. It means they don't end up spending money. If you're a concession card holder, once you get 36 prescriptions within a calendar year, you don't pay for your prescriptions. If you're a general patient like you and I, once you spend $1,500 thereabout a year, you only pay $7.30. So the government is not aware of the safety net, or they're just ignoring the safety net.
Are the estimates of pharmacy closures and job losses exaggerated?
No, I think it's under-exaggerated. I think it'll be much worse, unfortunately. Because of the current model, the rule has always been, since the inception of the PBS, the Pharmaceutical Benefit Scheme, based on 30-day supplies. Now, if the government want to decide to roll out a new policy, the agreement between the Pharmacy Guild of Australia and the federal government is to consult. And this is what we're asking the federal government, to pause this policy and to consult.
Where will this go next?
Well, we're continuing on trying to work with the government. It's looking to roll from the 1st of September.
But people like Health Minister Butler don't seem like they're going to give in anytime soon.
Well, the problem with the minister is he's not listening. He's refusing to listen. We're requesting that he listens. He negotiates with the sector on a solution.
It's great for you, great of you to come in on a Sunday night. I think this has got a long way still to go. And we'll have to just wait and see, and we'll see where the debate takes us. Thanks a lot for joining us tonight.